Well, the National Institute for Communicable Diseases is urging travellers to take proper precautions to avoid contracting cholera. The NICD says yellow fever outbreaks were recently reported in South Sudan and Nigeria. There's also an ongoing outbreak of Lassa fever in Nigeria, and multiple reports of anthrax in national parks in Zimbabwe, Namibia and Malawi have also been reported. To tell us more, we're joined by Dr. Juno Thomas from the NICD to tell us what's going on. Doc, good morning.
Morning.
And thanks for your time. So, a cholera warning, especially for those going in and out of Zimbabwe. What is happening there at the moment?
So since the beginning of September, there have been over 10,500 cases of cholera in Zimbabwe, predominantly around Harare, but has spread to most other provinces as well. We've had 4 cases of cholera imported from travellers returning from Zimbabwe so far. And we do expect that with the increased volumes of travel now around the holiday season, that many people will be exposed to cholera going home or visiting friends and relatives in Zimbabwe, then on return to South Africa presenting with illness.
So is this something that can be passed from person to person? Just I suppose a basic biology lesson here, or science, or is it something that is just waterborne, and if you are sort of consuming that water or bathing in it?
So it's waterborne, as you say. Contaminated water and inadequate sanitation and sewage is the major cause. You can get some transmission from person to person, but that's less likely. It's really adequate, safe water and sanitation that's the key issue, and that unfortunately is a persistent problem in Harare. So those problems haven't yet been addressed, so the threat is still there, and anyone visiting those areas where people have had cholera or that still have unsafe water supply and sanitation are at increased risk.
What are the symptoms? How would you know?
So most people, in fact, that have been exposed to cholera don't develop illness. It's only about 10% that do. But typically you get acutely ill. In other words, you were feeling fine and then suddenly you start feeling unwell, and diarrhea starts. And usually it's very profuse. Cholera is called rice water diarrhea. So you can become dehydrated very, very quickly. Some people get a bit of nausea and vomiting, but really it's very profuse diarrhea that's the hallmark of disease.
Now, you know, a lot of people will not be able to avoid traveling. They will have to go home. They will have to come back. What are the preventative things? What are some of the things you can do?
So make sure that you consume safe water and that you use safe water for cooking, for brushing teeth, for all of your eating and consumption.
Whatever you're consuming, yeah.
Yes. So if you can't get bottled water, then make water safe by boiling it for 5 minutes, or by adding a teaspoon of bleach to 20 litres and letting it stand. And really just making sure that your hygiene, when you go to the toilet, you wash your hands thoroughly afterwards, and wash your hands before and after all food preparation.
Now, while we have you here, we're talking about the other outbreaks, Lassa fever in Nigeria. I've never heard of that one in particular. And then anthrax, also in Zimbabwe, Namibia and Malawi. How worried should we be here with our travellers when it comes to those diseases?
Look, I mean, travellers to Nigeria at the moment are facing multiple risks, and yellow fever would be an important one, because that's preventable with a vaccine. And travellers to Nigeria really should be vaccinated before they leave this country. I think what's more of a risk, and not just outside of our borders but within, is malaria. This season promises to be another bumper season of malaria. There are parts, especially of Mpumalanga, the areas in Vembe, Mopani and Ehlanzeni districts that have now been upgraded in terms of their risk for malaria transmission. And in Mozambique, transmission is particularly high, and Zimbabwe. So travellers going to neighbouring countries and to those areas of Mpumalanga that are now at higher risk should make sure that they take all precautions.
Okay, is it too late to get your vaccinations done? Are you aware whether they are doing them even over this time, this week? Well, all of these, I suppose.
Okay, so for malaria, there aren't any vaccines. It's just that
medication.
You should visit your healthcare practitioner before you're traveling to get malaria preventive medication. Make sure you wear long sleeve clothing after dusk, and that you use insect preventive measures like the coils and spray. And more importantly, that if you visited a malaria area, should you develop fever and flu-like illness, that you see your doctor immediately and tell them that you've been to those areas so you can have a malaria test done. Yellow fever vaccine is available at travel clinics.
Okay,
so
and they'll be open this time. They will be open in this week if you're still traveling.
Fantastic.
Okay, so do your homework if you are going to be traveling. You've been warned about the dangers out there. Thank you very much. That's Juno Thomas. She's from the NICD, just educating us about these dangers that lurk if you're traveling outside of the country. Now,